My face was destroyed by a motorcycle accident. I had a disfigured left eye and mouth. I also couldn't breathe due to my right nostril being closed off from all the scar tissue.
Oh wow, that's a lot of trauma.
Let me ask you a question. When you look in the mirror and you say, this one or two things bothers me the most that you wish you could just make go away?
My eye. I don't have two of the same eye.
I did a lot of facial reconstruction throughout my training and even early in practice. One of the big things that we do as plastic surgeons is people who get in accidents and they break bones of their face and they essentially tear their face up, we try to put it back together. And the way I describe it, it's kind of like a jigsaw puzzle. You know, I've had people who've actually shot themselves in the face. They've survived it, and then you had to try to suture what you can back together. The good news with a lot of these injuries is that oftentimes the tissue is all still there. It's just been kind of torn apart. And so like a jigsaw puzzle, you put things back together and surprisingly, they can end up looking pretty darn good.
But now, thanks to Dr. Nassif, I can breathe. My eyes are more symmetrical and I can finally look in the mirror and not hate what's looking back at me.
The big change I see here is with her left eyelid. And that left eyelid was pulling down. This is called a retraction or an ectropion. The problem when the eyelid pulls down like this is that sometimes the eye won't be able to close completely at night, and you can get dry eye issues, you can dry out your cornea, and this could lead to corneal abrasions. So I'm assuming what he did with this operation is that he reconstructed that eyelid using some type of support. The support is typically cartilage that you can take from the inside the nose, and this cartilage can be put in the lower eyelid to create that structure to keep that eyelid higher so that she can close her eye again, and hopefully it looks more symmetric with the other side. Great job by Dr. Nassif.
I was 19 years old when my mom started noticing that around my eyes, you could see that it was a little bit puffy, a little bit swollen. By 2012, my face started leaning.
This is kind of unusual. She started off getting puffy and then lost a lot of volume in her face. Now, there are a lot of reasons for volume loss in the face. Some of them are kind of obvious. If you lose weight, your face can lose volume. One not uncommon side effect from antivirals like HIV medications is that you can get facial wasting. You can lose the volume of fat in your face. And this is something that Sculptra was FDA approved for over 20 years ago. That being said, I'm not sure what's causing her facial wasting. Let's find out a little bit more.
It wasn't until 2015 that a doctor finally figured out that I had sarcoidosis.
Well, that's interesting. Sarcoidosis is an autoimmune condition where your body deposits granulation tissue or little lumps and masses throughout the body. This isn't something that is traditionally associated with facial wasting. Usually with sarcoidosis, you get more lesions like lumps and bumps and facial plaques and things like that, not necessarily loss of volume in the face.
I started going to the doctors and I've done everything from derma rolling, putting collagen creams on my face. Nothing's happening.
So it sounds like people were trying to recommend natural ways for her to stimulate the collagen of her skin. Well, derma rolling can do that in a very minor way, and collagen creams don't do it at all. Collagen is a large protein, and if you put it on the surface of your skin, it just sits there. It doesn't do anything because it cannot penetrate the stratum corneum or the actual barrier of the skin itself. So don't waste your money on collagen creams at all. Now, a collagen supplement may help overall just to improve the quality of the skin, but it's not going to give her necessarily any volume back.
So, Kofa, what's nice about this, she has some immediate filling with the hyaluronic acids, and then the long-term, basically your body producing your own collagen from Sculptra.
So they're doing a combination of injecting a hyaluronic acid filler like Restylane or Juvederm with injecting Sculptra. Sculptra is a different type of filler where basically it's a powder that we mix with water. We inject it into areas of the face and it creates essentially new collagen in the area that you inject it. Hyaluronic acid fillers can last anywhere from 6 months up to 2 years. Sculptra can last 2 years, sometimes longer. Another option for her, however, is fat injections. You can take fat from another part of her body, purify that fat, and then inject it into her face. That might be my first line treatment over these types of injections because whatever you get with the fat stays permanently.
And this is just the beginning.
That's just the beginning.
Wow.
My face has regained its fullness. I look like myself again, and I feel great. My juicy face is back.
Wow, she does look incredible. I'm really happy for her. Once again, if this settles down here in the next couple of years, using fat may be a better option for her to give her a longer lasting result, but kudos to her doctors.
You have some remnant of muscle here. You have nothing right here. It's pure skin graft on bone.
Wow, that's what we call a shark bite wound, where it literally looks like a shark went in and bit the tissue off. Now, he had some type of open wound there, and it looks like they skin grafted over it to cause that wound to heal shut. Now the question is how do you get rid of that wound? Well, one way is you can basically cut it out and suture it back together.
Make an incision across your entire abdominal wall, extending into the unaffected right side. It'll have a better shot at matching the left side.
Right.
It's a tummy tuck on a guy.
So the reason behind doing a tummy tuck on him would be to remove tissue from the other side too, to try to make it so that he's symmetric, because that wound is so large that if you just cut that out and suture it together, he might be kind of walking like this for a while. So the idea is you want to take it off on both sides to try to create more symmetry. That does create a long scar though, and that scar extends from one side of the body all the way to the other. Scars are permanent, they never disappear. That's the big trade-off with this operation.
Before my surgery, there was a big gaping hole in my side, but now, thanks to Dr. Dubrow, the hole is gone. I have symmetry, and I'm no longer in pain when my work belt rubs against my side or anything.
He looks great. As you can tell, with the tummy tuck, there is a hip-to-hip scar, but there's also a little scar around the belly button. So if you look closely, and feel free to rewind that back and take a look at his belly button, there is a scar there. Tummy tucks are not just for women. Guys have tummy tucks too.
Check this out underneath my nose. I had a couple little bumps that were clear that I thought were probably some clogged pores, but it was basal carcinoma.
This is something I hear from patients all the time, where they have had a lot of sun exposure in the past, and they get just a little area like a little dot or a little wound that just does not heal. And sometimes this turns out to be a basal cell carcinoma. That's the most common skin cancer that there is. The good thing about a basal cell carcinoma is it's not that dangerous. Even though it can continue growing and can look pretty darn bad, it usually does not metastasize or go to other parts of the body and kill you.
He went in and cut the first margin and came back and said this is more than we thought it was.
So she underwent Mohs surgery for this operation. This is a procedure performed by specially trained dermatologists where they basically remove the skin cancer and they take little margins of that skin cancer out little by little as a way to try to remove the least amount of tissue necessary. Unfortunately, I've had patients who've had Mohs surgery for skin cancer like this. They come in with just a small little skin cancer, and sometimes the defect afterwards is big. I've seen people lose large portions of their nostrils, of their nose, even of their eyelid afterwards.
He said it was kind of like an iceberg.
Right.
Where he said it looked like a little bit on top and it was more spread out underneath.
Even though basal cell carcinoma is the least dangerous in general of skin cancers, there are several types of them. Some of them are more difficult to treat than others. As you can see, she lost what looks like the majority of her upper lip. Now, Mohs surgery technically is supposed to create the smallest defect possible with the highest cure rate, but still you get patients like her who have these large defects afterwards and can be definitely quite disfiguring.
So if we can maybe lift all this up, try to debulk some of this even down to here, that will hopefully get rid of some of the fullness, give us a little bit of lift like that.
Although I don't know exactly how her operation was performed, there are many ways to reconstruct an upper lip. Here's a diagram right up here from one of my journals where you can see all the different ways to reconstruct the upper lip. But even though you're doing that, there are always, unfortunately, side effects to it. And one big side effect is that you can find that the mouth, the actual stomal opening of the mouth, is smaller than it was prior to the defect happening. And I do believe she probably had one of these procedures performed on her as a way to reconstruct that upper lip, but as a negative, it left her with a much smaller mouth and no actual lip in the upper lip.
I'll start by performing a commissuroplasty by making an incision along the right corner of her mouth. We'll cut and transect the muscle and extend the two edges all the way to the corner to widen the opening of her mouth.
Now this is going to be huge for her because once again, what's happened with reconstructing that upper lip, most likely tissue is taken from the chin area, moved up to create the lip, and that causes the whole mouth to look smaller. So by opening that area up, she's going to have a larger mouth, which is going to look more natural for her.
Then I'll make an incision along an old scar by your nasolabial fold, lift up the skin graft, and debulk it as much as possible.
This is going to be the part that's going to be risky because whenever you lift a portion of a flap like that and debulk it, essentially he's taking tissue away. Some of that tissue may contain the blood supply that is needed for that area to heal. So that's where it can get a little bit choppy and a little bit risky.
Lastly, I'll perform a direct lip lift on the right side where she lost the most lip tissue to make her lips look more symmetric.
And that's going to be the easiest part of the operation. If you follow plastic surgeons on social media, you know that the upper lip lift, where you take skin from the base of the lip, is a very common procedure being performed today just to try to elevate the lips a bit and to make the length between the nose to the lips shorter. The problem with this operation is it does create a visible scar. With this patient, it's worthwhile to do it because she's got scars there anyway, but if you don't have any scars here, make sure that you're aware that that scar can be visible and can even potentially thicken.
Medical tattoo is the final step.
Looking back from the way I felt when this first happened, I didn't look the same anymore. It took away my identity.
There are many unsung heroes in medicine, and when you look at reconstructive surgery, one of the unsung heroes are the medical tattoo artists. Now, I don't see it a whole lot in facial reconstruction, but this is a perfect example where that can really work to create what appears to be her upper lip, but essentially it's a tattoo. We use medical tattooing a lot in breast reconstruction to recreate the areola, or the colored circle, around the nipple as well. And these are small things that when you think about in the scheme of things that can make huge impacts on how somebody feels about themselves.
For my surgery, my face looked like a Halloween mask. I had almost lost my entire lip to cancer. It was scarred and tight, and I didn't even recognize myself when I looked in the mirror.
Wow, what an incredible result. I mean, that just shows that when you have a plastic surgeon working with a medical tattoo artist, just the amazing reconstructions that you can create. So these are some amazing transformations, but the Bosch doctors also see some absolutely shocking patients that they may not want to operate on. You got to check out this video right up here where I react to some of their most shocking patients ever. These will blow your mind. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.